Welcome to the Healthcare Plus podcast, hosted by Quint Studer and Dan Collard. I'm Nicole Webb-Bodie, partner at Healthcare Plus Solutions Group. Thank you for joining us as we bring together leaders and changemakers from across the healthcare industry. In each high-impact segment, you'll hear about the latest challenges organizations are facing and learn how guests are rewiring solutions to drive real change. Plus, you'll walk away from each episode with practical tools, techniques, and best practices to implement in your own role and in your organization. For more information on your host or to listen to recent episodes of the podcast, please visit www.healthcareplussg.com/podcast. Now, here's your host, Quint Studer, who will introduce you to our next guest.
This is Quint Studer, Healthcare Plus podcast, and I'm really excited today to have Stephanie Montgomery with me. Dr. Montgomery is working very hard on helping children learn better and have more capacity to learn. Something called Build a Brain, Build a Life, Build a Community. So, Dr. Montgomery, thank you for joining me today.
Well, thank you for having me. Anytime I have an opportunity to talk about the work we can do as a community and healthcare system to improve the quality of our children's life is an opportunity that I certainly want to take advantage of. So thank you for this time.
Well, good. And tell a little bit about yourself, those of people that might not know who Dr. Stephanie Montgomery is.
Absolutely. So I'm originally from Georgia and grew up in a home where I was influenced by educators, grandparents, parents, aunts, uncles, the like. And so as a typical person being raised in that environment, I did not want to go into education, wanted to flee from that. And once I wised up and realized what an incredible impact that you can have on human life, I came full circle, finished out a degree in early childhood education, and have had opportunity to teach in several states in the South as well as up north in Minnesota, which was a lot of fun teaching kindergartners their letters and sounds with my Southern dialect, but that was a neat experience. And then continued to pursue advanced degrees in reading and curriculum instruction and wanted just to advance my learning so that I could better support the profession. So was in a classroom for a number of years and worked at a district level as a literacy coordinator, and then at a regional and state level helping underperforming schools to be able to maximize the impact that they can have on their students. So a little about me and my background and what led me to where I am today.
No, I appreciate that. I'm always listening to you, and we're going to listen in a little bit, but unfortunately for our listeners, they're going to listen to me for just a little bit now too, while I tell them how I got involved with this work. I have a not-for-profit I started, and it's a 501c3, so I'm a board member. I don't run it, but it's called Studer Community Institute. And what first things we did is a dashboard. And those of you that have read my book, Building a Vibrant Community, this will resonate with you. In our dashboard, I live in Escambia County, Florida, which has underperforming schools. And we all knew that. People would say, oh, we have to fix this, we have to fix that, third grade reading, fourth grade math. And then we did a dashboard as part of my not-for-profit. And we realized, because we're very fortunate in Florida that we have a standardized test to measure kindergarten readiness. Some states don't, which I think is a real disadvantage because it doesn't create that burning platform. And all of a sudden it showed up that like 43% of the kids are ready for kindergarten. And so the first thought we had was, how much of an influence does kindergarten readiness have on performance once they enter the public school system? Because I too spent 10 years in the classroom. And I know when a child comes into kindergarten not ready, though I didn't teach kindergarten, I know how difficult it is for the teachers to make decisions on their time, their students, and are they shortchanging any group, which they don't want to do. So we did some research, which led us up to the University of Chicago at Dr. Dana Susskind, who had written a book, 30 Million Words. We'll ask you some of that research as we get into it. And I got curious about it. So what I do many times is I fund someone to come down and teach the community. We call it civic conversations per se. She came down and we were sitting in a room And she just started talking about the brain, how the brain develops, and that every second after a child, even before, but let's say after a child is born, that they're not being included in learning and talking to, that we lose an opportunity. Because what hit me, Dr. Montgomery, is when she said something like 80 to 85% of the learning capacities develop so early on, age 3. And it just hit me. And then she talked about in Chicago, they were really working hard getting to these moms, particularly in lower socioeconomic, because research also showed kids growing up in certain lower socioeconomic hear less words, which means less chance for the brain to develop. And she said it was really difficult because to go into these homes, find the mom, do the teaching, and they lose days. And sometimes there's a trust issue with not even getting into the home.
Mm-hmm.
So I just mentioned, what if we did this at the hospitals? And she said, could you get the hospitals here to do that? I said, yes. So we paid actually $50,000 to be a beta site for University of Chicago. And our 3 hospitals started showing a video from the University of Chicago. And then 1,200 moms, that's all we could do because they wanted peer-reviewed research. So we couldn't give them a book, couldn't do anything but just the video. And basically, they showed peer-reviewed research that shows that improves a child's ability to learn, particularly those that lower socioeconomic, because they have a bigger chance to grow. Mm-hmm. So I got intrigued by this. And so that's what sort of birthed what you work at now, called Build a Brain, Build a Life, Build a Community. So I wrote my book, Build a Vibrant Community. John List, who's an economist who will someday win a Nobel Prize, I asked him to do the foreword, and I just said, could you do the foreword on how to build great communities? He resonated toward the early brain stuff. He's talked more about, from an economist's point of view, the early brain work is the best thing we can do to build a community. So we started this thing, Build a Brain, and now you work for Build a Brain. Carlton Ulmer runs Build a Brain, Build a Life, Build a Community, and we have Olivia, who now works with the organization. So as you've gotten into this, because what we wanted to do is bring this outside of Escambia County, Florida. And it's so inexpensive because the nursing staff is already there. So that's how we got here. And we are so lucky to find Dr. Montgomery because she brings an evidence-based approach. But that's what I know. But you've even got more evidence on this. Now, why don't you talk about what you've learned looking at what we've been doing and what we're doing now to help really communities via the hospital and the pediatricians working with parents on building brains?
Absolutely. So thank you for that introduction, and very, very fortunate to be able to work for Build a Brain, Build a Life, Build a Community, because as you mentioned, I have worked in underperforming schools, and you mentioned that as well. And so we spend an enormous amount of time, energy, and resources trying to move the needle, so to speak. We're trying to increase graduation rates, trying to increase the reading proficiency. And while we can make great strides in effort, kindergarten readiness really sets that trajectory for a child's future learning. So how do we get to those children before they even start kindergarten? That's where the real work begins. And so that's why I feel my evidence-based approach, my experiences and opportunities just lends great depth to the work that we're able to do in a hospital setting. We make a lot of assumptions, right? We make assumptions that parents know how to bolster brain development. We make assumptions that nurses on the mother-baby unit understand all the intricacies with early brain development. They're very well trained in the clinical aspect of delivering mother-baby unit discharge and everything involved in that medical aspect. But perhaps they don't know everything that's happening in that critical first 3 years. One of the things I've enjoyed most in working with our healthcare systems, and specifically coaching our nurses, is that they get so excited when they learn this information. They didn't know that, for example, language peaks between 6 months and 12 months. So what that means by language peaks, we don't have children talking in full sentences and conversing between 6 and 12 months, but all future language and speech opportunities are being developed during that time. So the synaptic connections between 6 and 12 months are being made long before we hear evidence of that. So we spend a lot of time also with literacy, reading to your child, getting your child in a literature-rich environment. And while that's extremely important, and I have a reading background, so I don't want to diminish the positive effects of that, it's really more about talking with your child. A book can be the vehicle for that language and that sing-song and that play and that interaction. And so think of it like an iceberg. There's so many things happening underneath the surface in a child's brain as we're building that architecture that we're not yet going to see the evidence of for a few months or maybe a year or two down the road. And so I think that's the most powerful message that we can share not only with our healthcare systems, but with parents as well. There's a lot happening in those first 3 years that we have to maximize on in that critical window of time. Because as you know, after that period of time, around 80 to 85% of the brain is developed for future learning in the first 3 years. And then those neural connections that are not formed begin to prune off. So while that doesn't mean that we can't continue to learn, we have something called brain plasticity, but that takes a little longer.
You were recently in Lafayette, Louisiana. They did a really neat thing called the Big Idea, and they're doing such great work creating more vibrant Lafayette. It's so exciting. You and Carlton were there, and as Carlton was sharing to me, you were sharing things about the brain and the smoothness and the whole.
Yeah.
He said that everyone was leaning in, and I leaned in when he was telling me it. Talk about the whole development of the brain and the learning that you did with them, and what we think children are, what their brain's not ready to do versus what it is ready to do.
Absolutely. And we do often function from a deficit mindset. But yes, let's talk about what it is ready to do. So I started out, I'm sharing with the group. And again, we're going back to assumptions. We assume that we all know how we learn and how the brain works, right? So I started with, did you know that the brain was not designed to read and write? Just kind of paused a minute. And you could see people kind of tilting their heads, somewhat perplexed, like, well, that doesn't make sense because all of our standardized data that we somewhat measure IQ and, school achievement is really with reading and math scores as well. No, the brain was designed for speech and language. That's what we were designed to do. And so if we don't have a nice, firm, robust foundation of speech and language, then we're not going to be able to produce proficient readers and writers. We have to have people who can articulate their thinking, to ask for help, to advocate, thinking in terms of the medical community. If someone is equipped with language and an ability to interact in a reciprocal conversation back and forth, they're better equipped to advocate for their needs, which turns into an ability to advocate for health care, to advocate for resources and supports that they need. So that's one of the messages that I think is worth continuing to inform healthcare systems, communities, parents about, and equip them with vehicles such as books and information so that they can learn more about the critical period of time when language is being developed. And it's not just overheard language, Quint. Some people think, oh, I can turn something on a TV or screen, or they hear adults talking. It's actually the active engagement in the conversation that bolsters the most language propensity.
Yeah, when I talk about this, the first thing that people say with all good intention, well, we give them a book or we're doing literacy stuff, all good stuff. Nothing wrong with any of this, but I keep coming back to how do we start with the mom or dad, but particularly we find in today's environment, the whole family, but let's just, for this conversation, say moms, or again, people listening can include anyone who's with the baby. We look at use of screens, we look at different daycare challenges, and what we find is children are actually hearing less words now, not more words. So let's talk though about, we all know the reason what, the why. Let's talk about the how. So when you look at, when I go to a community, I bring this up and I said, the hospital is usually very leaning forward. Wow, we'd like to do this. Plus everybody in the community looks so grateful that you are willing to do this, because now you're doing something that is really going to help the entire community, even more so than we thought, the great work that healthcare providers do.
Right.
Talk about what you do when a hospital or health system says, can you help us set up this program?
Sure, absolutely. I've been talking a bit about the brain and the complexity there. And one message we want to make sure that everyone hears: the brain is complex, but helping to inform and equip parents of their role as the first teacher shouldn't be complex. We want to make it really easy. So as you mentioned before, we have a video that's been peer reviewed, and now we have 6 to 7 years of data to support that we are informing all parents across different socioeconomic determinants. We're able to meet the needs of parents by informing them of what they can do to help bolster their child's brain development. So showing a video in a hospital setting, that starts with a conversation with a nurse or a volunteer. Talking with a parent about this unique opportunity they have to have their child kindergarten ready. After the video, the parent is asked
For
2
people
questions.
listening, how long is the video?
The video is less than 5 minutes.
Okay.
So in the grand scheme of things, the video is less than 5 minutes. It's very engaging. It's very informative, and all parents can relate to the information being shared. And that's really important. We want to be relatable, and we want to ensure that all parents can see themselves, be empowered to really change the trajectory of their child's life. And so, yes, less than 5 minutes. They're asked 2 questions. How would you rate your knowledge of the power and role you can play in building your child's brain through language before having watched the video, and then after, just as 1 to 10, just indicating maybe a 6, and then maybe after, maybe an 8 or 9. We're seeing huge gains in narrowing the gap there between information that they knew prior and then after having watched. And one of the things that we're strategic about is asking prior to watching the video, how would you rate? We do that actually after they've watched the video. Going back to assumptions being made, you don't really know how to gauge until you have the information, right? So then after they're given this information, they're able to rate their knowledge gained. And so that increases each time, the survey. And so we have lots of data now that we're able to substantiate the role that the video plays in the hospital setting to increase awareness in parents. And so then we give them lots of opportunities to continue that learning, because we know it doesn't stop just with a video. Now we've captured their interest, and we want to equip them with some tangible tools and resources they can continue to use. So 1, we have a Baby Steps milestone book. What I love about this book is, 1, it continues to evolve based on feedback from our communities and our healthcare systems. As they let us know things that they want included, we can add that. So that's been fun work that we've been able to add content. I'd like to give you an example of a great outcome that we didn't think that we would see this quickly, but we are over the moon to hear how our Baby Steps milestone book is impacting children directly. So an example is, we were in Lafayette, Louisiana, just recently, as you mentioned, and connected with Mindy Hertzel, who's at Auctioner Jennings. Now, they've been using the Baby Steps milestone book along with the video now for about 2 years. She was sharing with Carlton and I that she had recently heard from one of her pediatricians that said he is now able to detect developmental delays earlier because of the use of this book. Parents are bringing the book in. Parents are informed. There's pages within the book. So it works developmentally. So as your child grows, we provide information that helps you to notice cognitive, social, language, physical, developmental milestones. There are places in the book as a reminder, it's now time to schedule that well baby visit. Well baby visits are different than sick babies. Those are intentionally designed to make sure that your child is developing as they should based on peers their age. It also equips parents with things to notice and note. Because when you go into that pediatric visit, sometimes you may be rushed, have other children with you that are vying for your attention, but that's precious time to be able to let the pediatrician know, here's what I'm seeing and noticing, raise any questions. So because of that, Quint, that's astounding. A pediatrician is saying, I can see and identify children with developmental delays earlier because of this. That's huge to me.
No, I think the book too, what pediatricians, like you said, and what but the reason the book was developed was we couldn't find anything. We couldn't find anything that does this. We have books that talk about physical, these types of things. And I know you do an awful lot, but tell me, for example, when we were in an organization or a city, How do you how do you start with the nurses to help them, the education process of nurses? Because I know nurses are really busy, but I also know nurses are one of the most value-driven human beings that ever existed. And once they see evidence that this makes a difference, they
Yeah.
want to do it. But how do you go about helping investing in the development of the nurses so when they go in, they understand the process?
Absolutely. So we have several things afforded to them to help the implementation process. So one is we have a nurse training video. It was filmed right here at Baptist Hospital with one of our fabulous nurses, Catherine. She has a heart for this work. She sees evidence of the success of equipping families, talking with families, building that relationship, because we all want to see our youngest be successful, right? And so we have nurse training videos, we have scripting available, we have coaching. And so again, as part of Build a Brain, we want the community, the healthcare setting to be successful in this work. And so our coaching, our quarterly partnership calls, these are fantastic, where our partners, our healthcare systems get on a call together quarterly. We're able to share best practices. We've got up in Illinois, we have a fourth trimester program going on right now. These moms meet in a library. They are provided education, support. This is helping to address postpartum depression and maternal mental health support. It's a fantastic idea. We're able to share those best practices across our partner healthcare systems through that quarterly partnership call. And then I follow up with coaching. What did you hear that you want to try? What barriers are you running up against? I always go back to, and I took this from you and Carlton, I always go back to informing a parent and caregiver about the important role that they play in those first 3 years is as important, if not more, than the training of installing a car seat, bathing, feeding your baby. They're all important. This has lifetime positive consequences if we do it right. So it's not a nice to have or an opt in. It's imperative that we make sure that parents have that information because most parents just maybe don't know, and it has nothing to do with income, you know, cultural influence, race. It's all parents. We enter into this kind of starry eyed, right?
A couple things for our listeners. With Joint Commission, this
Mhm.
checks the box on health equity, just so that you know. So when you're asked about the best thing we can do for health equity is what we're doing right now with this. It's amazing. So we didn't do it for that, but it does check a box for the Joint Commission. The other thing I think that's really been amazing, I watched the video years ago with Dana Suskin,
Mhm.
and I sat here and said, I didn't know that. I didn't know that. I didn't know that. And that was my first thought. They told us how to bathe the baby. They told us the hearing test results, breastfeeding, umbilical cord, all these great things that were really helpful to us, but we really never talked about anything above the neck.
Mhm.
And this deserves equal attention. So I talk about physicians as we get near the end here. I've been really impressed because, again, physicians, I sat in a room with neonatologists, and neonatologist almost started saying, my gosh, when a baby's in a NICU, the parents are really, again, terrified about the
Mhm.
physical health, also thinking about everything. And they have hours and hours of wondering. And he said, this educating about building the brain,
Mhm.
they were all over it about how this would be helpful. So talk about the response you've got from both physicians, OBGYNs, pediatricians, and so forth.
Right. Well, again, I think that sometimes we make an assumption that people understand how the brain and that architecture is being formed. And so I'd like to go back. You mentioned this earlier and I didn't speak to it. So thinking about architecture of the brain. So you may be thinking about, a building of sort and building that strong foundation with language. Actually, the neural connections being made, so there's 1 million neural connections per second being made for infant through toddler years. And so those connections actually form the crevices of the brain. So the smoother the brain, then it's been said to be the lower IQ. So we want to make lots of connections and almost a bumpy brain because that creates more surface area for future learning. So when pediatricians, while they may be aware of this because of their long, intensive studies to become a pediatrician, reminding pediatricians of this information that's valuable to share with parents, I think is also another role that we play. Reminding pediatricians of the important conversations, building it into those pediatric visits so that pediatricians can remind and encourage parents all those interactions, experiences that you're having with your child, whether it's stimulating their five senses, taking them outside to play, which increases endorphins, which facilitates learning. All those pieces of information baked into the pediatric visit empowers the parent. It creates trust and a relationship with the pediatrician. And so it's a win-win of sorts because we all succeed when our children are given the maximum opportunity to be successful in school and in life. So going back to your question, our pediatricians are just gravitating to this, the Baby Steps book, the video being used in a healthcare setting because it sets the stage for them to be able to do the good work of well baby development. And also it provides them with the example I used earlier, with an opportunity to lean in and ask more questions about the development of that child because the pediatrician's not with them 24/7 like parents and caregivers are. So the more equipped a parent caregiver is to bring that information to the pediatrician, then the pediatrician there can do a better job with identification, support, and maybe outreach services if there is something suspected of needing additional intervention.
Yes, what I found with this, which I thought was sort of fascinating, again, was asked to speak to the Department of Pediatrics and a healthcare system. As we talked about it, they started sharing.
Mhm.
And of course, they all do have these conversations. No doctor said, "Oh, no, I never talk about brain development." They all do it. But then as they started talking, it's a really healthy conversation. Well, how do you do it? How do you do it? And we found is a little inconsistent. So they actually went into the electronic medical record, started putting in brain development or child brain development questions to ask when the parent comes in, write an electronic health record to prompt them to do it, but also to ask it and be a little more consistent. So I was asked on some show maybe 4 years ago, if I could only accomplish one thing in my career, what would it be? And I said, truly to make sure every parent that leaves the hospital understands the tremendous power they have to build their baby's brain. And I know because we're in a very poor county in Escambia County. We're the second poorest large county in the state of Florida. It's really quite amazing when a mom sits there and understands for her to get out of poverty, it's going to be real long haul, but she can certainly get her child out of poverty and help her child. And we've had parents cry when they've watched the video because they've got other children that they wish they would have done this with. And we don't want them to cry, but it shows the power of the learning process. So for our listeners who want to learn more about this, where can they go to learn more about Build a Brain, Build a Life, Build a Community? And for those of you in healthcare, this is like the most inexpensive program you'll ever hear about, ever. This is a 0.1 decimal point on your financials. So how can they learn more about Build a Brain, Build a Life, Build a Community, Stephanie?
So 2 ways that you can find out more information. One, you can go to our website, buildabrainnow.com. So that's buildabrainnow.com. And then you can reach out to either Carlton, Olivia, or myself. Our emails are the same, Stephanie@buildabrainnow.com, or Carlton or Olivia. We'd love the opportunity to talk with you, to be able to see how the work that we're doing can integrate into the fabulous work that you're doing in your healthcare system so that we can ensure that every child has the opportunity to reach their maximum potential.
Well, thank you, Dr. Montgomery. I've always learned from you, and I hope I'm sure our listeners did, because our listeners are people that really want to improve the quality of life for their community. So thank you, everyone, for listening to the Healthcare Plus podcast. This is Quint Studer, again, signing off with our program, Build a Brain, Build a Life, Build a Community with Dr. Stephanie Montgomery. Thank you.
If you would like free resources and access to our latest books, articles, and industry insights, visit our website at healthcareplussg.com. We hope you'll join us next time as we continue our journey to make healthcare better for caregivers, patients, and communities.